Good morning. Thank you, Gopal. We have been hearing about the various intravitreal injections, the options available. We have our approved drugs, the Lucentis, Aflibercept, Ozurdex, and all that. And of late, most of us had started to believe that the days of Avastin are gone. We have our biosimilars in place, but over the last 1 or 2 weeks, we have seen quite a few alerts over the social media as well as official alerts from the Vitreoretinal Society that one particular batch of biosimilars have started giving trouble yet again. That means we have not yet seen the end of the off-label drug. We are a nation like India where people pay out of their pockets for the treatment, and at least for a few more years, Avastin is here to stay. So we have to manage the multidose vial, and how do we safely manage it? Following the alert notice by the DCGI a couple of years back, the All India Ophthalmological Society and the Vitreoretinal Society of India had constituted an expert committee. The DCGI, on the recommendations of the expert committee, withdrew the high alert in March 2016 with very strict guidelines. First one was how to prevent a counterfeit bevacizumab. We have been procuring Avastin from the standard dealers, and there have been instances of some dealers offering the drug at a lower price, and at least a few of us had procured the drug from these sources and landed up in trouble. So we have to make sure that the drug is not a counterfeit drug, and the Kessler code is a unique alphanumeric code printed on each vial of the drug. The validity and genuineness of the drug can be confirmed by the manufacturer directly by messaging the code using the short message service. This was the direction which was given by the DCGI at the time of giving approval for Avastin. But I'm not very sure whether the Kessler code has been introduced over all the brands, all the batches. The manufacturer agreed to be responsible for the sterility and purity of bevacizumab and to ensure a proper documented cold chain before delivering it to the authorized distributors. And it's our responsibility to check the cold chain record from the manufacturer to the distributor periodically. The carton of bevacizumab may preferably be stored in an airtight, screwable, clean plastic container to prevent wetting of the carton, and it has to be stored under 2 to 8 degrees Celsius. Since it's an off-label drug and we are procuring it from the distributor, we ourselves transport it, we have to make sure that this temperature of 2 to 8 degrees Celsius is maintained throughout, otherwise the drug becomes inactive. Once purchased, transport the drug in a dry ice pack. It should be stored in the hospital in an exclusive refrigerator, exclusive for drugs and if possible exclusive for the intravitreal injections, at 2 to 8 degrees Celsius with temperature display, power backup, and a temperature log. Do not store any non-drug related items such as food and beverages, all that is understood, and ideally keep it within the pharmacy or in your operating room so that it doesn't get mixed up with the other material. The refrigerator should be lockable only, and only specific persons should have access to the refrigerator. A separate register should be kept to keep the record of the bevacizumab usage, from which vial you are using, where you are fractionated, and the date of starting use, the last date of use, and all that. This should have the following information: the name of the person who transferred the vial to the refrigerator, record of utilization of the vial with the lot number, aliquot preparation date, and sample sent for culture and the reporting. And in case the culture comes positive, report to the distributor and inform on the national registry with the lot number. And also inform your peers. Don't try to cover up that we had such a problem. Inform your peers through our official channels. We have quite a few options to prepare Avastin for injecting into the eye. The option 1 is the ideal method, but hardly anyone practices that in India. It's a compounding pharmacy to prepare single dose ampoules or aliquots to be practiced in sterile laboratories, which class 10 facilities under the laminar flow hood. And here we prepare ampoules within the compounding pharmacy itself, and then these ampoules are distributed to the treating physician. An extensive evaluation of intravitreal Avastin prepared by the 11 US academic compounding pharmacies under good manufacturing practice facilities showed no microbial or endotoxin contamination, but there was a fact that each of these ampoules had varying concentrations of varying quantums of the drug available. So that means the quality of the drug was ensured with these compounding pharmacies, but not the quantity of the drug. Option 2 is what most of us practice in India. It's fractionation and aliquoting as per the VRSI guidelines. Fractionation, we open a vial and prepare the required number of injections in 1 ml syringes under sterile conditions, ideally under an ISO class 5 condition. It has to be a clean room with a laminar flow hood, a compounding isolator, or in our circumstance, we can use a sterile operation theatre with a HEPA filter or laminar flow with filter. The scrubbing and gowning should be done as for any intraocular surgery. It has to be done by a nurse or a doctor or a nurse who is regularly assisting your vitreoretinal surgeries. That means the person should have all the concepts of asepsis in the operating room. Open the cap of the vial, clean the rubber stopper with the sterilium. I'll go to the video. The scrubbed staff should withdraw 0.2 ml of the bevacizumab in a 1 ml disposable syringe without injecting any air and cap it with a needle, and then it's packed. Yeah, I'll go to the video here. We clean the rubber stopper with sterilium. The person who is aliquoting should be scrubbed and gloved as for any intraocular procedure, and the person who is assisting should also be gloved. The bottle is held upside down throughout the process of aliquoting. Either a 23 gauge or a 20 gauge needle can be used for withdrawing, but it should be just a single prick. You should not have multiple pricks on your rubber stopper. Draw 0.2 ml, bring it to 0.1 ml, and then put back your needle. We can bend the needle or cap it as you feel. Prepare all the aliquots in one go. Don't keep your unused drug back for a second day. Prepare all the aliquots in one go. Keep all your 15 or 20 or whatever number of aliquots you are planning to prepare. Keep your syringes together, and throughout the process, make sure that no unauthorized person enters the room. There should not be any talking in between, no unnecessary talking. It has to be under the HEPA filter.
Mask should be covering the nose and mouth.
Yes. Yes.
Always no talking in between.
Yeah. So that's about taking the drug. And once you have got your drug, then the next step is packing the drug. It has to be packed in sterile pouches. It should ideally be packed in sterile double pouches. Under, again, all aseptic precautions. Do not touch here and there unnecessarily with your ungloved hand or unsterile instrument. And each aliquot syringe is packed in the sterile pouch. Yeah, then it's closed and sealed. The pouch is sealed and it goes for ETO. And each of these has to be packed and labeled as to which batch, when it was packed, and then sent for ETO, because we are going to store them.
ETO is not done now. That is, some people do. You can't go for ETO after. You can't
Okay.
do the molecule will get
Okay.
no, the ETO will go into the ETO, the pouch can be used and then seal it and keep
Then seal it and keep it. Okay.
Okay. But why did it go for ETO? It was already a sterile pack. It was an ETO pack was
The pack was ETO.
after that you can't do it.
So each pack is packed separately, labeled and stored. Now, option 3 is to pool the patients for injection on a particular day. Again, this is a practice which can be done where there is a good load of intravitreal injections, where you have maybe 15 or so patients a week. All these patients can be called on a day, and here what we have to make sure is that we don't go and draw each syringe for each injection. See how many patients you have on a particular day, draw the number of syringes together and keep it, and then start injecting one by one, and consider each case as a new case, because the person who is injecting, the sister who is assisting, all should be scrubbed as if for a new case, gloved as if for a new case. This technique has limited published data and hence has to be followed with caution and at the discretion of the ophthalmologist under very strict aseptic conditions. The open vial should not be used under any circumstances on a second day. Culture is to be sent on day 1 and wait for 48 hours for the culture report and file it for our documentation. Multiple drawing from the same vial increases the risk of contamination, and also wiping the rubber septum with fingers or dirty gauze. If there is a rubber stoppage leakage, that happens when you inject a 20 gauge needle into that, draw it for once, then again introduce a needle for a second time, there will be multiple pricks in the rubber stopper. Poor aseptic technique like entering the vial without alcohol swabbing, injection of air into the vial while removing the solution, which is a practice of many of our nurses. Use a contaminated needle or syringe for drug removal, and inappropriate storage durations and temperature. However, studies have shown that so long as sterile techniques are implemented, there were no cases of endophthalmitis from the same vial. So these are a couple of reports about intravitreal bevacizumab, the safety of multiple doses from a single vial for consecutive patients. Although many centers allocate multiple syringes from a single vial to be kept in a refrigerator for use, the current study shows that so long as proper sterile techniques are implemented, there were no cases for endophthalmitis from using the same vial. Here it says that bevacizumab does not lose stability when stored at 4 degrees Celsius. It may be used for a week by direct withdrawal from the vial without fear of infection or contamination if all standard precautions related to intravitreal injections are adhered to. But in our practice, it's always better not to keep the half-used vial for more than a day. Pan American Collaborative Retina Study Group reported more frequent endophthalmitis in eyes injected using previously compounded aliquots than in eyes given injections from the same multidose vial that was reused appropriately. Cluster endophthalmitis after Avastin injection prepared by the compounding pharmacy. In this outbreak of endophthalmitis after intravitreal bevacizumab injection, Streptococcus oralis was cultured from the majority of patients and from all the unused syringes. Visual outcomes were generally poor. The most likely cause of this outbreak was contamination during syringe preparation by the compounding pharmacy. So that is where we have to be very, very careful. That is while preparing the aliquots for injection. Can open vials of Avastin be transported to multiple centers? We have many of our physicians practicing at different centers, injecting at different areas, and the workload at each of these centers might not be sufficient for opening one vial of Avastin. But please make sure do not transport the partially used vials in ice packs. Do not transport the aliquoted syringes of bevacizumab also, because we are not aliquoting under the laboratory conditions specified as for a pharmaceutical preparation. We are doing it in our operation theatre. If a surgeon is practicing at multiple centers, it is recommended that each center be equipped to fractionate bevacizumab, and if this is not feasible, it's recommended that the patient can be taken to the nearest center for the injection. Here, the vial showed no contamination on storage for 7 days in an ordinary refrigerator. Again, that's a report from the Western world, that from our own people, that it can be stored. But these are all situations which are better be avoided, and don't store the drug. As the approval of intravitreal use of bevacizumab and its subsequent availability in the market in a single dose, that is 0.05 ml ampoules, is still awaited if at all it comes. Using the single dose vial and aliquoting into smaller doses of multiple uses is recommended. However, there is a risk of microbial contamination, and the need to stay vigilant against pre-existing contamination within the vial or its access to drug via multiple pricks. Thank you.